Every day we come into contact with bacteria and germs, and most of these are harmless. But some can cause infections that make you ill, and of these there are a few that can cause serious harm to you and your baby, so it's important to avoid them if you can.
When you're pregnant, your immune system isn't as strong as it would have been pre-pregnancy. So that might mean that you're more at risk of getting coughs and colds, and more at risk of getting in touch with infection, which can be harmful for you and the baby.
One of the ways infections can spread is from person to person.
You should avoid people with infectious diseases while you're pregnant, as you might be more at risk of becoming unwell yourself, and then that can be harmful for yourself and the baby developing and growing. So if someone has a flu, or if they have nausea or vomiting or chicken pox or any other kind of diseases, they're best avoided until they are better.
As well as colds and flu, there are other infections that can be spread by coughing and sneezing. One that can harm babies in the womb is called parvovirus. It's common in children and can sometimes cause a red rash on the face, so you might hear it called slapped cheek syndrome. If you come into contact with anyone who has it, you should talk to your doctor.
There we go. Do you want to have a seat?
Another way you can come into contact with germs is handling uncooked food. Washing and peeling fruit and veg can help remove any dirt and germs. Be especially careful with raw meat. You should always store and prepare it separately and cook it thoroughly. If you have pets at home, remember to wash your hands regularly. Avoid cleaning the cage or litter tray, especially if you have a cat, as their poo can contain a parasite called toxoplasma that can cause miscarriage or stillbirth. If you do need to do it, remember to wear rubber gloves. Other infections can come from bacteria that can exist in your body at any time. For instance, up to a quarter of women will have bacteria called Group B strep, or GBS, in their vagina in pregnancy. Usually this doesn't cause problems, but a small number of babies develop serious GBS infection, usually in their first 24 hours, but also up to age 3 months. If GBS has been found during your pregnancy, you'll be offered antibiotics given through a drip once labour starts to prevent the infection passing to your baby. Babies infected with GBS will need urgent treatment with antibiotics. Common symptoms are similar to those of other infections and include grunting, being floppy and unresponsive or irritable, not feeding well, high or low temperature, fast or slow heart rate, and fast or slow breathing rate. If your baby has any of these symptoms, it's important they see a doctor as soon as possible.
Women might experience more urinary tract infections as well. So you might feel that you generally have pain and discomfort when trying to urinate or to pass water. The most important thing and the best thing you can do for yourself and your developing baby is to seek help.
How's it been going?
It's important to speak to your doctor, as many of these infections can be treated so you feel better and your baby is at less risk of harm. It's also important to look after your sexual health when you're pregnant. If you think you or your partner may have a sexually transmitted infection, you should talk to your midwife, who may put you in touch with a local sexual health clinic.
If you recently find out that your partner has a sexually transmitted infection, then it's very important to seek advice from a sexual health clinic and be seen to get treatment for yourself. The best thing is not to feel ashamed, because nobody's going to judge you. Our role is to hope that you feel comfortable and able to talk to us so we can do the tests, the necessary tests that need to be done, and make sure you get treated to keep you well and to keep your baby well. You know, it's out of our